Hi guys, welcome to this screencast where we are going to be looking at heat. Okay, so we have just been looking at altitude and acclimatization to altitude. Now we're looking at a different environmental challenge that our body has to kind of adapt to in terms of exercise and performance, and that is heat. So first of all, if we just go through the specification and what is expected. So environmental effects on body systems, we've looked at this. So the exercise altitude in terms of altitude itself, and then acclimatization to altitude. Over the next couple of lessons, we are going to be looking at exercise in the heat and the effect of heat on the cardiovascular and respiratory system, as well as temperature regulation and this term cardiovascular drift. So here are some sample questions that I wanted to give you before we actually went into what we need to be doing in terms of heat. First of all, a 4-marker at the top there, which is from a sample paper. Explain what is meant by the term cardiovascular drift, so hopefully you can understand the importance of that term. And then also at the bottom, this was from the October 2020 paper, identify two effects which exercise in the heat can have on the cardiovascular system. Specifically, the cardiovascular system we're asking for there, not both the respiratory system and cardiovascular, just the cardiovascular system. So let's get to it. First of all, key terms we need to be aware of that you need to get down and ensure you have Cornell notes on. Thermoreceptors. This is kind of just giving you a reminder of thermoreceptors because we have done them before. Remember, these detect changes in temperature, which obviously is going to be really important when we're discussing exercising in heat, because clearly we are going to become warmer. Dehydration is an important term we need to be aware of, which is the loss of water in body tissues, largely caused by sweat, which you're going to realise becomes a key aspect of exercising in heat. And then finally, cardiovascular drift. This is a really shortened version, or kind of like shortened definition of what cardiovascular drift actually is. Okay, so it's an upward drift in heart rate to compensate for the decrease in stroke volume. So similarly to altitude, stroke volume is going to decrease because of that our heart rate needs to increase. This is known as cardiovascular drift, but we need to know why during heat does stroke volume decrease, and that is what we're going to be going through today. So here we have just got some images. I've got the sun, which is trying to represent heat, with thermometers that are trying to represent on the left hand side, our core body temperature. So normal human body temperature is approximately around about 37 degrees. There is daily rises and falls of no more than 1 degree. Okay, so 37 degrees is our kind of like internal core temperature. So when we think about our core, we're thinking about our kind of right inside our inner part there, of our abdomen. Our centre really, and that is approximately 37 degrees. If you think room temperature is usually about 21 degrees average, 37 degrees is quite warm, and that is our normal human body temperature. Now, yes, I said we have daily rises and falls of no more than 1 degrees, but let's say we're at 38, which is normal in terms of a rise in heat. Or core temperature, sorry. When we start to exercise in heat, we're obviously going to become even warmer. Now, if we get an increase in body temperature by literally 1 degree more than that 1 degree sway that we have, this can have significant cardiovascular and respiratory implications. This can really affect us and affect our performance and affect both our cardiovascular and respiratory system. Now, if you think about certain events or certain sporting performances that happen in different countries globally now. So globally, sport is huge, where it's happening all over the world. For example, the Qatar World Cup, it's happening in 2022. After this screencast, after we've done these lessons, hopefully you're going to understand why, instead of taking place in the summer where there's 50-degree heat, it's going to take place in December, where it's going to be cooler for the athletes taking part, because it's just too dangerous to have such high level competitive sport at such a high temperature. Okay, so the effects of heat on the cardiovascular system. So I've mentioned this term cardiovascular drift to you. Now, these are the notes you need to get down. These are quite important. So as core body temperature increases, Okay, so it increases from 37 degrees, cardiovascular drift occurs, which is an upward drift in heart rate. Okay, now we need to know why this happens. Now, we know that it happens because of stroke volume decreasing, but how does stroke volume, or why does stroke volume decrease? We're going to go through the steps now, which is going to initiate why stroke volume decreases, therefore why we get this cardiovascular drift. So, when we exercise in heat, our heart rate straight away increases. Now, it can increase like 10 beats per minute with regards to like a 1 degree change in temperature outside. Okay, that's not core temperature, just temperature outside. So that's a really big change. So what happens is thermoreceptors detect an increase in heat, and this causes the arterioles and precapillary sphincters at the skin to vasodilate. Remember, vasodilate is widening, and then hopefully you remember from doing the vascular shunt mechanism that the arterioles and the precapillary sphincters are part of the blood vessels that vasodilate, widen. So thermoreceptors detect an increase in heat. This causes the arterioles and precapillary sphincters at this skin to vasodilate. So now we're exercising, however, we're getting more blood going to the surface of the skin. This happens to increase blood flow. What happens with this is it means we get blood pooling around there, which I'm going to speak about in a minute. But so because we get an increase in blood flow to the surface of the skin, this means that heat can radiate off ourselves and we can sweat to lose heat. So it's really important that exercising in heat increases our heart rate, which is known as a cardiovascular drift. This occurs because thermoreceptors detect an increase in heart rate, which causes the arterioles and precapillary sphincters at the skin to vasodilate. So now we're getting that increase in blood flow to the skin so that we can lose heat through the radiation and sweating. However, what happens is the blood pools at the skin. So the blood actually stays around that skin area. So what does this mean for all of our other CV system? What does this mean for stroke volume, cardiac output, and so forth? So what this means is because this blood flow is now going to the surface of the skin and not necessarily to the muscle, and it's also pooling there, what this means is we get a decrease in blood volume, or we actually get a decrease in venous return first of all. This decrease in blood volume is from sweat. So because we're sweating out and we're losing water, remember plasma is made up of 90% water, and we lose blood volume. Therefore, because we're sweating to reduce our heat, this means we're losing blood volume, which conversely means that we're going to get a decrease in venous return, i.e. this blood going back to the heart now, we're reducing because first of all we haven't got as much blood in our system because we're sweating and we're losing that blood plasma. We have also got blood pooling occurring, which means the blood is staying around the surface of the skin, which means we're getting less blood back to the heart, i.e. we get a decrease in venous return. What does this mean? This means we're going to get a decrease in stroke volume and cardiac output. Therefore, that is why we get an increase in heart rate, because we are trying to maintain cardiac output because stroke volume has decreased. However, just like altitude, we can't. Okay, so cardiac output, heart rate increases to try and maintain cardiac output, but it's unsuccessful. This means we get a reduced oxygen to the muscles, which is going to reduce aerobic performance. That is the effects of heat on the cardiovascular system. I realise the first time we look at this, that may seem like quite a lot to remember, but if you tell it as a story, it kind of makes sense with regards to blood going to the surface of the skin so that heat can radiate from us and sweat from our blood. Then all of a sudden, because we're sweating, we're losing blood volume, which means we're going to get less blood going back to the heart, which means stroke volume, the amount of blood leaving the left ventricle per beat, is going to decrease, which means we get this cardiovascular drift, which is this increase in heart rate to try and maintain cardiac output, but that's a failure. This means we're going to get reduced oxygen to the muscles because we haven't got enough blood leaving the heart per beat, therefore per minute, which is going to affect aerobic performance. So now if we move on to the respiratory system, So what we're looking at now is the effects of heat on the respiratory system. Right at the start of this screencast, I asked us to look at dehydration and what dehydration was, and the fact that it is the loss of water in body tissue, largely caused by sweat. So now if you're thinking we are sweating loads now, we're losing water, this means we're going to be dehydrated, which is not good. Okay, so dehydration and drying of airways, what do we think that is going to lead to if we are if we've got a really dry airway and we're dehydrated? This means that we're going to get constriction of airways and increased mucus production. Okay, so now we've got this increase in mucus being produced. We're almost constricted in our airways, which clearly means that we're going to get less air into our lungs for gaseous exchange. So we're going to get a decreased volume of air for gaseous exchange. Therefore, we're going to get an increased breathing frequency to try and maintain this oxygen consumption. So every time we breathe in now, we've got a decreased volume of air coming into lungs because of this constriction of the airways and increased mucus production, which means, hang about, I'm going to have to start breathing more frequently now so that I can maintain oxygen consumption. This means at the end of performance, we've got an increased oxygen cost because we're not getting enough oxygen on board straight away. What does this mean? Decreased aerobic performance leading to early OBLA, onset of blood lactic acid, which is clearly going to affect our aerobic performance. So they are the notes you need to be making on your screencast. Please ensure that you have got decent cornell notes and questioning, as there's a lot to get down there, and then we'll revisit this in lesson. Thank you. Bye.